So in terms of therapeutic and side effects, opioids at low to moderate doses have analgesic effects. They block the transmission of nociceptive information from the body to the brain, and they do so at a number of points in networks that are transferring this information, that linking up detection of injury to perceptual experiences of pain, including in the spinal cord, at the level of the spinal cord, and also at the brainstem. They also can generate a little minor respiratory depression, which may be actually associated with the use of opioids, for example, to suppress coughs, right? You can get Robitussin with codeine, for example, which is designed to suppress coughs, but part of it could be that it's actually suppressing breathing to some extent. So I mean, minor, hopefully at that stage. So it may not be helping in the long run. Impaired concentration, pupillary constriction. Your pupils constrict a bit on low to moderate doses. We'll see on high doses they get what they call pinpoint pupils, dreamy sleep it can sort of promote, and also constipation. And what's always interesting about that is, again, what's a therapeutic effect and what's a side effect depends on what do you need. In the case of some kind of awful diarrhea or something like that, you take Imodium, right? You take an opioid because that constipation is actually a therapeutic effect. But in other circumstances, it may not be. What you're after, it would be classified sort of as a side effect. At higher doses, of course, there's dysphoria, restlessness, nausea. Some people actually have, significant nausea responses, as a side effect, because nobody really wants that as a therapeutic effect ever, to even low or moderate doses. And if you've had opioids, and many Americans have had them in the past, you'll know that about yourself. if you need to avoid opioids because of the potential for nausea, at higher doses, people who become dependent basically on the drug, on opioids, on this class of drugs, tend to report a euphoric sort of kick with rapid administration, like through injection, like IV injection, for example. At even higher doses, of course, there's sort of respiratory, failure, and again, awkwardly, this is sometimes, the intended, therapeutic effect, quote, quote, I mean, for euthanasia, for example, but it's also, one of the major risks of, overdose on opioids. If somebody comes in to the emergency room with significant difficulty breathing, you might think COVID-19 today too, but significant difficulty breathing and pinpoint pupils, they'll check the pupils. That's a sign that they, may need some immediate assistance, to basically, deal with an opioid overdose at the time.